Hello students, today we will talk about antihypertensive. Antihypertensive agents are the drugs which are used in the treatment of high blood pressure. Hypertension is a condition in which the systolic pressure exceeds 160 mm of Hg and the diastolic pressure exceeds 95 mm of Hg. There are two types of it, essential or primary. The causes are unknown here, but it may be caused because of some genetic factors or dietary factors or obesity. It is a major risk of stroke, congestive heart failure, and coronary artery diseases that affects women more than men. The other type is secondary hypertension that results from known causes. This can be divided into four forms: renal, neurogenic, endocrine, and cardiovascular. Let us talk about classification of antihypertensive drugs. Here we have the first class is diuretics. Now we have discussed diuretics in a separate class. Okay, now diuretics are the drugs which increase the rate of urine formation and they increase the urination. We have different category of drugs in this. We have something called loop diuretics. They block sodium and chloride reabsorption in the kidneys like furosemide. So there is reduced renal vascular resistance and improved renal flow. Then potassium sparing diuretics, which are competitive antagonists that compete with aldosterone, and also something like amiloride, which directly blocks sodium channels. Then we also have thiazide diuretics, which reduce the blood pressure by sodium and water excretion. The second class is sympathetic depressant agents. As you can see, there are various categories here. The first one, let us discuss centrally acting agents like methyl dopa or clonidine. Now, clonidine acts centrally as alpha 2 agonist. So, this produces inhibition of sympathetic vasomotor centers. So, reduce sympathetic outflow to the periphery and hence reduce total peripheral resistance and reduces the blood pressure. Then we have methyl dopa, which is alpha 2 agonist, that is converted into methyl norepinephrine centrally to diminish adrenergic outflow from CNS. Then we have adrenergic neuron blocking agents like trimethophan, reserpine. Reserpine is alkaloid. We'll be discussing this, obtained from Rauwolfia serpentina. Then we have beta adrenergic antagonist. Now propranolol, as you can see, this is the first beta blocker which was used as antihypertensive. This is a non-selective because it blocks both beta 1 and beta 2. So this is non-selective. This is now replaced by metoprolol, atenolol. Now the beta adrenergic blockers, that is metoprolol, atenolol, they are cardioselective. So they inhibit the beta 1 adrenergic receptors, and that is how they cause the hypotension. Then we have alpha adrenergic antagonists like prazosin. The prazosin is alpha 1 adrenergic blocking agents. Now drugs like this act by reducing arterial pressure by dilating both resistance and capacitance vessels. And then we have mixed antagonists like labetalol. They have both beta blocking as well as vasodilating effect and hence useful in hypertension. The next class of drugs is vasodilators. We have arterial vasodilators like hydrazine and minoxidil, and we also have arterial and venous vasodilators like nitroprusside. Now these vasodilators produce relaxation of vascular smooth muscles in arteries and arterioles that results into decreased peripheral resistance. They are not used as the primary drugs drug treatment, but they will be used in combination. Then we have calcium channel blockers. This we have discussed in antiarrhythmic drugs also, like nifedipine, diltiazem. And then we have angiotensin converting enzyme, captopril, lisinopril. Now this ACE inhibitors, they reduce angiotensin 2. Angiotensin converting enzyme is responsible for conversion of angiotensin 1 into angiotensin 2. Angiotensin 2 is a potent vasoconstrictor and it also causes secretion of aldosterone. And both these actions lead to increased blood pressure. So when we are inhibiting angiotensin converting enzyme, we reduce angiotensin 2. So that causes reduced vasoconstriction. Okay, so enhanced vasodilatation is the first result. Secondly, they also reduce the secretion of aldosterone, so there will be decreased sodium and water retention. And thirdly, they increase bradykinin levels. Bradykinin produces peptide which causes increase NO, that is nitric oxide, which is a potent vasodilatation. So all these effects help into reducing the blood pressure. Then we talk about the first category, that is centrally acting drugs, that is clonidine hydrochloride. As you can see the structure, this is 2,2,6-dichloroanilino, 2-imidazoline. Properties: white, odorless, bitter tasting crystalline powder, freely soluble in water and alcohol, and very slightly soluble in chloroform, stable in air, light. Heat melting point is 300 degrees Celsius. So this is used in the treatment of essential hypertension, also used in postmenopausal vasomotor instability, dysmenorrhea, prophylaxis of migraine attacks. And the dosage is 0.1 milligram twice daily. Then we talk about reserpine. You can see the structure. This is 1117 dimethoxy, 18,345 dimethoxybenzyloxy, yohimbine. Now reserpine, this is alkaloid obtained from Rauwolfia serpentina. This is fine, slightly yellowish, odorless, tasteless crystalline powder, insoluble in water, freely in chloroform. And this is used in the treatment of mild to moderate hypertension with the diuretic. The dosage 0.05 to 0.2 milligram once daily. The dosage forms, we have tablets, extended release, capsules and injection. Then we talk about hydrazine hydrochloride. Hydrazine is a vasodilator. This is a white crystalline powder, freely soluble in water, sparingly soluble in alcohol and very slightly in ether. This is used in mild to moderate severe hypertension, and this is widely used to treat hypertension that occurs during pregnancy, always used in combination with other drugs. Now this is also used in the congestive heart failure and myocardial infarction. The dosage 5 to 10 milligrams 4 times a day for 2 to 4 days. Tablets available as tablets and injections. We talk about the drug Hydrazine hydrochloride. This is 1,4-amino-6,7-dimethoxy, 2-quinazolinol, 4-2-phenyl piperazine monohydrochloride. This is white crystalline powder, slightly soluble in water, and this is used to treat hypertension of any degree. It is also used in the patients with a pheochromocytoma, that is a tumor of adrenal medulla, and this is useful in decreasing cardiac overload. Oral dose is added 0.5 to 1 gram, and the dosage forms capsules. We talk about the drug minoxidil. This is 2,6-diamino, 6-piperidino-pyrimidine preoxide. This is available as white crystalline powder, slightly soluble in water, readily soluble in alcohol and insoluble in chloroform and acetone. This is a direct acting peripheral vasodilator. It lowers the total vascular peripheral resistance and hence the blood pressure. This is the best observed for the treatment of severe hypertension that responds poorly to other antihypertensives. Should never be used along with diuretic. The dosage is 5 milligram once daily. So the dosage form 2.5 and 10 milligram tablets. Then we talk about captopril. These are the ACE inhibitors. The structure, it is 1,3 mercapto, 2 methyl, 1 oxapropyl, L proline. This is a white or crystalline powder with a slight sulfidal odor, soluble in water, alcohol, sparingly soluble in chloroform. The melting point is 88. This is the first orally active ACE inhibitors, and this is used in the treatment of severe essential and renovascular hypertension and CHF. The dosage 25 milligrams orally 3 times a day. The dosage forms tablets 25, 50 and 100 milligrams. We talk about nifedipine. This is 1,4-dihydro, 2,6-dimethyl, 4,2-nitrophenyl, 3,5-pyrimidine, carboxylic acid, methyl ester. This is pale yellow, insoluble in water, slightly soluble in alcohol, and very slightly soluble in chloroform. The solutions are extremely light sensitive. Melting point is 174. This is a potent peripheral vasodilator. The dosage form available as 10 milligrams. We have diazoxide, which is 7-chloro, 3-methyl, 2H1,2,4 benzothiazide, 1,1 oxide. This is a white odorless crystalline powder, practically insoluble in water and slightly soluble in alcohol. Melting point 330. This produces fall in BP by a vasoconstrictor effect on arterioles and reduction in the peripheral resistance. Also used for the intractable hypoglycemic condition. The dosage IV 300 milligram, oral 0.4 to 1 gram daily, or in 2 or 3 divided dosage. The dosage form tablets, suspension as well as capsules. And lastly, we'll discuss diltiazem hydrochloride, available as white crystal, soluble in water, alcohol and chloroform. This is a potent coronary vasodilator. The drug is used to treat ventricular tachycardia and ventricular fibrillation caused by coronary artery spasm. The dosage either 30 mg 4 times a day, and the dosage form available as tablets 30 and 60 milligrams. Thank you. Please find the notes in the description, which is given in the link. Thank you.